Hello, everyone. Welcome back to your health talk with Sarah Network Discoveries with me, Dr. Isatu Kakay-Diallo. Today, we will take a new topic and to continue from where we left off, which is we last discussed hypertension and some of the risk factors for the topic that we're going to be talking about today is the hypertension that we discussed previously. Well, before we could start talking about, the stroke, which is going to be our topic for today, we just want to throw a highlight on few of the things that we've discussed. Some of the things that you can do as a patient or someone who's living with hypertension or family member who's living with hypertension. So we talked about, diet, salt, fluid restriction, and also monitoring excessive fluid consumption, especially if you are somebody that actually, retain fluids and also have lower extremity edemas. Also exercise, and activities will definitely help you in how you can control and manage your hypertension or high blood pressure. Also, you want to manage your stress level. That's something else that you can do to in collaboration or in conjunction with the pharmacological therapy that will be prescribed for you, whether it's the ACE inhibitors or calcium channel blockers or beta blockers. And also things you can also do is to prevent infection. And in addition to that, cut down on alcohol consumption. If you are somebody that smokes, you want to cut down on cigarettes or even try to quit, because what smoking does to your health, it's detrimental, and it actually would increases or raises your blood pressure. So, and also you want to talk to your family members. If you are not the one living with high blood pressure, you talk to family members living with high blood pressure or hypertension about things that they can do in their life to in order to manage or control their blood pressure. Because if the blood pressure is not well controlled, what it can lead to, it can lead to stroke and other heart conditions that can be detrimental to your life. Briefly, I just wanted to say this part of the segment in a local dialect, which is Creole. So for misalon pamuden where they listen or where they watch right now, I they try for say if you're not person we get high blood pressure, waiting you for do for let you manage your blood pressure. One, you want for decide for let you exercise. If you're not somebody we know they actively move around, exercise, watch the salt way they eat. Also if you're not possible they drink alcohol, you want for cut down on your alcohol level. If you're not possible way they stress yourself too much, because stress self can bring you so many things and we can raise your blood pressure. And when they talk about high blood pressure, where the doctor go down diagnose you, say you get high blood pressure, meaning your blood pressure is high past 140 over 90. Because really the normal range what you look at now anywhere from 90 to 140. And then that not the top part of the blood pressure, and then the bottom part of it, like we check your blood pressure, you look at 60 to 90. Anything above that, based on your age, definitely they consider that as high blood pressure. And also if you take medication, you see say you take medication, you watch your diet, you do all the things and where the doctor say let you do, but you still they find that difficult for controlling blood pressure, do a follow-up. Because if you do a follow-up, maybe you need for change your medication, maybe they need for add one more medication along with your diet, your exercise. And the other thing where I go look for say lot of, sometimes we'll get with plate, we can feel say the best thing for do now for eat all with food then 1 time per day, not to that for do what we need for try for do really, we for try for divide with plate into three. So with the half of the plate, we don't divide it into three, like half of it basically for be fruits and vegetables. Then the other half you divide down into two. That for entails maybe if not fish you they eat now, the meat you want for cut down on the meat because landed them back in raise your blood pressure. And then the next thing where you want to really focus on, the other side, you can add rest. If not anything we get starch, that you need like part of your diet. We know they say because you will get diabetes from glucose or when a starch, for eat am, you still need am, your body need am, you need carbohydrates, but you just for do am in moderation. So some of the things and sometimes waiting people then get for understand. If you not somebody where you don't carry age, if you not somebody will get family history of high blood pressure, you not go to change them thing and day. All you go able for do now for try your best and let you go manage you risk factors them, things that will go put you at risk for high blood pressure. So once you don't know, say your mama or your papa or your siblings, then your brothers, sisters or auntie, they are then get blood pressure issue. You self they at risk. You own risk higher past that other person. We not get no family history, no relatives with high blood pressure. So for Miss Alon family them, we get for take them very seriously. Say if the doctor don't diagnose you with blood pressure problem, take your medication, do diet, do exercise, continue for the monitor. Things are not the change, you see doctor back so that then go really see what thing then go do. Because if your blood pressure really in they at certain number, you they at risk for something what then they call stroke. And now the topic today we will get for can discuss in a little bit more in depth as we end this part of it. So we just talked about some of the things that people can do in terms of managing their high blood pressure in a local dialect, which we call Creole. So these are for people that really we want them to not only be told in English but also for them to understand it in something that they can see and relate to. So sometimes when we talk about high blood pressure, there are complications that can happen. So what are some of these complications? You're talking about left ventricular hypertrophy, because now the heart is working so hard just to pump blood into different part of the body. So that's why if you have high blood pressure, because there's a constriction of the vessels, for your body to really push blood to where it needs to go. So that's why caffeine, which is like smoking, really contains caffeine. We tell patients to cut down on smoking, because doing that really can help in how their blood pressure can be controlled. Because over time this is what will happen to you. You would have the left ventricles of your heart will become bigger or larger. And then another thing that can happen for somebody who has high blood pressure is heart failure. That it puts them at risk for their heart to fail. Both can be due to like a reduced ejection fraction, which is like the systolic part of it, and also preserved ejection fraction, which is the diastolic part of it. And the other thing that can happen is ischemic stroke, which ischemic stroke really is when you have decreased oxygenation to the brain. And then you have intracranial hemorrhage. It's a form of stroke, which is there's a bleeding within the intracranial part of the brain. And then then another thing that can happen is chronic kidney disease or end stage renal disease. So these are things that can happen because if someone has a high blood pressure and they do not take the necessary precautions or managements that have been prescribed for them, can lead to all these different things. So, and the other thing, they may have myocardial infarction or some other coronary artery diseases. So definitely take your blood pressure medication, follow these different simple life change measures or measures that you can do in order for you to control your blood pressure. The other thing that we talked about, what is a stroke? Like I said, there's different types of stroke, but about two types of strokes that are being classified here. You're talking about hemorrhagic stroke and ischemic stroke. Hemorrhagic, the word hemorrhagic means bleeding. Ischemic means lack of oxygenation, and they are dramatically opposite conditions, right? So the hemorrhagic is because it's characterized by too much blood within the closed cranial cavity, while ischemic is characterized by too little blood to supply an adequate amount of oxygen and nutrients to the brain. So when that happens, the person can develop stroke. And and this type of stroke can be identified by doing a CAT scan, which is a computer tomography scan that would tell, is this person having an ischemic stroke or are they having a hemorrhagic stroke? So the major leading cause, or the most common and risk factor for stroke, is hypertension, a topic that we started with, and also smoking is another risk factor that increases your risk for stroke. So definitely, if you are somebody that smokes, you do want to consider quitting smoking because it increases your risk over time. The other thing that we do want to talk about, again, is the percentage. So we have about 80%, approximately 80% of strokes are due to ischemic cerebral infarct or infarction, and while 20% of those strokes are due to hemorrhagic. So as you can see, the deadly one, which is the hemorrhagic, it's about 20%, and then the one that is more common, the ischemic, the lack of oxygenation, is 80%. So these are things that we should look out for as we are diagnosed with high blood pressure. Sometimes there could be an occlusion within the arteries, within the walls of the cranial nerve. So like the patient can have anoxia, which is mean lack of oxygen, and they could have thrombus, which is like a clot that's formed within the arteries, and also or the vessels. Then they have the hemorrhagic stroke, where the person already have a ruptured vessels within the brain. So if the vessels become ruptured, what's going to happen, there's going to cause bleeding. This is going to cause bleeding, and that bleeding can go on for some time without the person really knowing that this is what's happening to them. So definitely take a look at some of the signs and symptoms that can happen to patients, and also managing other risk factors. But there are key things here we want to focus on. The patient that's developing a stroke or experiencing a stroke, what are some of the things that you, a family member, a friend living with them, can look out for that they have in a stroke? So there's an acronym we've created, which is called FAST, or which has been created by different foundations. Like the Stroke Foundation has the word FAST, which means like that's a FAST, right? So each of these means a lot, and in helping you taking the family member, the loved one, to the healthcare facility in order for them to be diagnosed, or calling the ambulance, because really, or the medical personnel, to help take the patient to the nearest stroke center or the nearest hospital. So we talked about F. What is F standing for? F means face, right? So if the patient is having a facial droop, they're not symmetrical. The face is not equal. There's one part of the face that is drooping, while the other one is on the opposite direction. That's a sign of a stroke. And then arms. Why arms? Because the patient cannot lift their arms. So if you're doing an assessment, you're asking the patient, can you lift both arms for me? So you see that they're having one-sided stroke, so which we talk about after this. So you're telling the patient, can you lift your arm? They can do one, but the other one, they cannot lift it, right? So this patient is having a stroke on the opposite side of the brain. And then speech. When they're talking to you, they don't make sense. They're speaking in a slurred voice, or you cannot even understand what they're trying to say to you. That's a sign also for stroke. And time. Why time? It is critical. The sooner you take the patient to the medical facility, to the health center, the better it is for them to be diagnosed and treated promptly. So that's why the acronym FAST will help anybody out there living with a loved one that's experiencing stroke. So when we do have stroke, what we want to understand. So if your right side is being weak, actually the stroke or the problem within the brain is happening on the left side. So because as you get to part of our brain, as it gets out to the spinal cord, it crosses over. So like this part of the brain is actually dealing with the right side, while vice versa, right? So definitely see these acronym as something that you can use to recognize stroke. So the first thing the Stroke Foundation is asking you to do, think fast. Think fast, meaning facial droop, weak arms or weakness to the right-sided, slurred speech, and doing it in a timely fashion. Um, some of the different things that can really happen, like characteristics of stroke or subtypes of stroke. So the intracranial hemorrhage is a gradual onset and progression during minutes or hours in most patients, but sometimes it may happen abruptly. Doesn't mean it's gonna stick with that. In some cases, patients can develop stroke abruptly. Their risk factors, again, hypertension, because maybe they were involved in a motor vehicle accident or in some form of trauma. Bleeding, can cause them to have, a stroke. And also if somebody that doing drugs put them at risk for stroke, like amphetamines or some illegal drugs. Also vascular malformation, and more common in blacks and Asians than in white people, when we talk about stroke. And other things can be precipitating stroke would be, sex or other physical or strenuous activities can put the patient at risk for stroke. And also the other form of stroke, which is like the ischemic, which could be due to a thrombi or a clot within the arteries or within the veins. What can happen is there's a blockage, so there's not enough blood flow within the brain, so the patient is at risk because either they have high cholesterol. So when you have high cholesterol, you narrowing the arteries, so now blood is not pumping, well enough to go to the necessary organs or all these different organs. So, and if you are somebody that have diabetes, you are at risk for this type of stroke. And you are somebody, your age has advanced, put you at further risk for developing this. And patients can have what we call transient ischemic attack. This is a type of stroke that can last up to 24 hours, like from few seconds to 24 hours. But the patient would recover. And we call this type of stroke as a warning sign of an impending or a bigger stroke. So once you've noticed that you had a mini stroke, people will call it mini stroke, but it's a warning sign. So you need to take all different measures in order for you to manage blood pressure and other stress levels that will put you at risk of developing a stroke that is major. Because with that, patient can have so many problems, meaning they would probably not be able to walk because of the right-sided weakness or left-sided weakness. They would not be able to eat solid food. They would have to be fed. They have to go through therapy in order for them to, do these type of things. So definitely these are things that we should look out for. And then the take-home message, definitely when your patient is experiencing signs and symptoms of stroke, maybe you may want to consider to do the EKG. But like first, when the patient comes to your clinic as a clinician or to the hospital, the things that they would consider as strokes or signs that mimic stroke would be like patient may have migraine, syncope, they may have like seizures. These are things that tend to mimic the signs of stroke. So once these are not things that mimic stroke, like you've done the CT scan, they've done all the different testing, they've identified it's a stroke, the patient go for therapy, and treatment. So one last thing that I want to talk about is what part of our brain really does. We have different part of our brain, and the next topic will focus on traumatic brain injury. So like the frontal lobe definitely deal with our movement, our mood, our intelligence and judgment. And then there is also our behavior and personalities, all in the frontal lobe of our brain, and our memory. Then you talk about the temporal, which is on the side of the brain, affects your speech, your behavior, your memory, your emotion, your vision, and your hearing. Then you have other parts, which is the brain stem. Then that controls the blood pressure, breathing, heartbeats, and swelling. Then you have the parietal lobe. Then you're talking about your language and your reading, coordination and sensation, as well as your intelligence and reasoning is where the parietal lobe, focuses on. Then you have your occipital lobe that focuses on your vision as well. Then along with that, you have the cerebellum that focuses on your balance and your coordination and fine muscular control. So we'll end today's talk segment, just for a brief moment to talk to people that, really would benefit, from this topic in Creole. So for me, them, where you get high blood pressure, take them very serious. Like we don't say you get for manage them well. If you not manage them well, we think could happen. You could get stroke. When you get stroke, meaning they get enough oxygen now you brain, or because now bleeding now don't happen. Some of the vessels then your brain don't bleed. So where that happen, like 80% of the stroke then we people then they get now the ischemic one, where we see then get lack of oxygenation because either then get high blood pressure, then get high cholesterol, then get diabetes, all that thing, and they can make the person develop stroke like 80%. Then the 20% now bleeding, now the hemorrhagic one, the one where they bleed, but something where you will help somebody where they deal with stroke, it go be let you learn 4 things them. If you see say this person in face where you look at, it not look equal. One side they down, one side they up. That need for tell you say na sign of stroke this person don dey get. The next thing you tell am say, you begin say weak, e dey waka somehow. You tell am say put your 2 hand up. You no able put both hand. Na one normal able for ace for you. That means say this person dey experience sign of stroke. The other thing where the national or the stroke foundation they ask we for Lord think of again, the speech where the person they talk to you, they make sense. Wetin they try for say, they try for tell you something, but they will produce all the word that we want tell you. So then the back na sign for stroke. The other thing na time. The sooner you take this person, for let them go see an hospital, let them do the CAT scan for see na bleeding, na blood they have or na bleeding or something, na the vessel don't cut or don't broke or don't burst, whichever way you want tama. Now that na the problem. Then do a CAT scan, then go find out na bleeding, na a stroke wey be say na bleed, they bleed, or na a stroke wey be say na because get oxygen na in brain, or na because they get blockage within that vessel, they na make the blood not go where it's supposed for go. And where the blood not go, wetin get for happen, they get oxygen, they get nutrients. You see how they eat and everything, the brain self need that, and it need that for let you function on your daily basis. So if you can think of something where then they call FAST, we mean if you walk fast, run fast, take the person now hospital, so then go look this person for really find out what's wrong with them. Okay, so I will end that segment there. For no see the next time we will talk about what really for do what will brain in function they do for we, and also why make we for take care of our brain. In order for make you do anything in life, you forget a good and healthy brain. So with that, I just want to end today's segment by saying that the next time we meet, after talking about the functions of different parts of the brain, the different lobes, we may want to discuss, traumatic brain injury, and to let us know that the brain, having a healthy brain, really would see how we do well in society and actually help us in our daily lives as well as our future. So viewers and listeners know that the Health Talk with Sarah Network Discoveries will be coming every Monday to you on different topics, and topics that we going to like and want to really be doing part of our daily lives. But how can you continue to get a notification on this? You definitely want to follow us or subscribe to our YouTube channel at Sarah Network Discoveries, and this health talk will come to you live or premiere every Monday, going forward. Thank you for watching, and please feel free to like, subscribe, and share, because note that when you learn something about your health, sharing it will definitely benefit somebody else. So please follow us and also share with other people as well. And don't forget to this now our channel. We therefore make sure see when you know something, if you tell the other person. When you don't tell the other person, what thing will happen? You don't teach other person. Down the back they go and teach the other one. This is not about we health. For Lord do something right. Lord try for Lord subscribe to Sarah Network Discovery. You know, where they talk about health, they talk about other different things, and but the health talk go they come to una every Monday. So that way they una like, subscribe, una share, comment, make I know what una wanna talk about next. I will always go based on what una the viewers then or the listeners then wanna talk about. The next topic now I go talk about. So la no type am right now.